Hello. At this year's Vermont Nurse Practitioners Association annual conference, keynote speaker Geraldine Bednash from the American Association of Colleges of Nursing summarized research indicating that 80% of all primary care services can be delivered by nurse practitioners and physician's assistants at the same and in some instances better quality and lower cost when compared to medical doctors. Considering this piece of information among the sea of changes about us with healthcare reform, both nationally and the state of Vermont, ultimately means that exciting opportunities are arising for nurse practitioners, especially here in the state of Vermont with our new autonomy, which was signed into law by Governor Peter Shumlin on June 1st of this year. What I would like to draw your attention to is a specific situation happening here in the state of Vermont. Fletcher Allen Healthcare is not only one of our largest employers, but indeed the largest employer of healthcare professionals. A few years ago, nurses working there organized together to create the union under the Vermont Federation of Nurse Health Professionals. At the time the union organized, the only group of advanced practice nurses that opted to be exempted from the contract and negotiations were the certified registered nurse anesthetist. Otherwise, all nurses from LPN to APRNs are included in the contract negotiations unless they're exempted for the customary reasons of being in a managerial or a supervisory position. Again, what I'm drawing your attention to tonight is the possibility that because nurse practitioners at Fletcher Allen are members of the nurses union, they are in fact being hampered from being hired for jobs and development, both personally and as for nurse practitioners as a profession, because Fletcher Allen would prefer to hire physician's assistants who are employees that are not members of the union. If we look towards the literature to find out what's happening in other places, there really is little that has happened or has been written about. There's action happening in Canada and Australia, but it's very hard to draw comparisons since those are countries that have been on very different trajectories, both in offering universal health care and in how unions and labor was organized in their countries. So, my proposed action is that nurse practitioners employed at Fletcher Allen come together to make a conscious decision about their involvement in the union. I need to impress upon you what a very hot topic this is, and even opening the doors to this conversation is a bit like grabbing a tiger by the tail. People feel very strongly about unions. My own personal experience with this has been in preparing for this project. When I contacted the administrative offices of the Vermont Federation of Nurse and Health Professionals, I simply said I was a graduate student working on nurse practitioners' involvement in unions. I had an immediate response. As soon as I clarified that I was looking to what it would take for nurse practitioners to be exempted, all communications with me were cut off. And email was sent to me kind of inquiring who I was and why was I writing this. So, like I said, it's a very hot topic. Now, one avenue that we could have to address this change would be through the Vermont Nurse Practitioners Association. So I had a conversation with Dr. Jennifer Laurent, the current president. She explained to me that the organization doesn't provide position statements and wouldn't really consider approaching the union regarding this. She did say that the organization would be a good platform to have the conversation through their webpage and their listserv. But for a number of different reasons, it's not something that they would be likely to approach the union about. In understanding the complexities of this and with the knowledge that the state of Vermont is indeed a small town, I would like to point out that I learned that the Vermont Nurse Practitioners Association and the Nurses Union actually share the same lobbyist as well as many of the same numbers. So what are the possible actions that could happen? Well, in negotiating contracts, it's fairly complicated. This is really our first barrier to change, which is the regulatory barrier. To change the contract as it stands, it's unlikely that it could be as simple as amending the contract during the next round of negotiations. What's more likely is that to change, we would have to have the National Labor Relations Board decertify, that is, disband the union as it exists now, only to recertify with nurse practitioners not being included. The financial barriers that we must consider really affect the individual nurses working at Fletcher Allen, in that currently nurse practitioners at Fletcher Allen do not have the opportunity to negotiate for their own salaries. Rather, the salaries are established by the contract, which has a very specific arrangements of steps and wages. The possibilities of this are really, and implications of this can expand even further as nurse practitioners gain new autonomy, in that we don't know what the field and the landscape will look like as we're able to perhaps have more reimbursements for the work that we do. It is possible that the limitations of our negotiated salaries will mean that we're missing out on the opportunity for greater reimbursement for the work that we do. The social barriers and the cultural barriers are quite intense in that, as I mentioned, whenever discussing a union, it's a hot topic and people feel very passionately about it. Specifically at Fletcher Allen, nurse practitioners essentially seceding from the union have the potential of seriously alienating the nurses that we work with. And as all nurse practitioners have been known to say, we were nurses first. So something that we may be fairly hesitant to do. Again, those political barriers come back to how do we make this change? Now, if we begin to look at this information on the public marketplace, what we find is that there's the potential for a real win-win here for both sides. On the side of the nurse practitioners, getting this information out could be an opportunity for education, as we know that there's a lot of confusion in the general public about the roles of advanced practice nurses. It could be another opportunity to highlight our new autonomy and the ability in our scope of practice for the general public. On the side of the nurses' union, having this information in the public could also be an opportunity for them to express and explain how much support and benefit they've been to the nurses and health professionals employed at Fletcher Allen. The stakeholders in this are fairly simple. Primarily, we're talking about the Vermont Federation of Nurse Health Professionals and Fletcher Allen Healthcare, specifically the administration, the MDs, the NPs, the PAs, all of the other nurses and health professionals. When we begin to look at the secondary stakeholders, that's where we move out to the National Labor Review Board and nurse practitioners associations, both here in the state of Vermont as well as nationally, and national nurses unions. The state of Vermont needs to keep in mind that the eyes of the nation are on us, as our healthcare reform is unique in its single-payer system approach, so that any issue that arises as Vermont is moving through these changes is likely to gain some national attention. Now, the timing of these issues is interesting. Unfortunately, for 2011, we've missed the deadline for consideration, any items to be raised for consideration in contract negotiations. That happens in April. So what I'm suggesting is that nurse practitioners, not only across the state, but specifically at Fletcher Allen Healthcare, begin to have these conversations, begin to discuss, and come to a decision so that we are intentionally deciding to either belong or be exempt from the nurse practitioner union. From here, I expect that this conversation, as I said, will begin to take place on the Vermont Nurse Practitioners Association webpage, and then we'll begin to figure out how we can engage specifically those advanced practice nurses working at Fletcher Allen. So in closing, I'd like to thank you for taking time to consider this important issue. As we move forward with our new autonomy, we need to be aware of the implications that belonging to unions could have, and the possibility that union membership is just another wedge in the divide between us and the physician's assistants and medical doctors. Again, thank you for your time and your consideration.